This is the Winning in Winnipeg podcast, where we talk to top performing business owners, executives, entrepreneurs, and local Winnipeg celebrities. We get to learn who they are, how they think, and we get to hear their perspective about what's really going on in Winnipeg and their businesses. Today, I have Dr. Leon Waye. Dr. Waye is a full scope family physician. His practices focus on obstetrics, obesity medicine, men's health, and LGBT health. Through training in surgery and advanced medical aesthetics, Dr. Waye learned the cosmetic construction of the face. His area of interest lies in the non-invasive manipulation of anatomical structures to achieve mathematical beauty. Dr. Waye is an active member of the College of Family Physicians of Canada. He completed his family medicine training in Winnipeg and a fellowship in integrative health through the University of Arizona in 2015. He co-founded Form Aesthetics to bring a focused medical aesthetic practice to women, men, and the LGBT community. Dr. Waye, welcome to the show.
Hi, how's it going?
It's going very well, thanks. It is such a... I'm lucky to have you here.
Oh,
One of the amazing... There's so much that I could actually talk to you about, and we've already talked for about an hour before this.
yeah. Not about anything important.
No, we don't have to put that stuff on.
Yeah.
Yep. But where I really wanted to start was just for anyone listening that kind of doesn't know you yet. Like, what's your origin story? Because there's certain things, like, I didn't know that you weren't from Winnipeg.
I am not from Winnipeg. So I grew up on the East Coast.
Okay.
Kind of traveled all over the world. Always had an interest in medicine. Took the very long way of getting there. Was a performer, Broadway actor, and did all that
really?
stuff. Yeah, back in the day.
What age was that at?
Early 20s. I thought I was going to be an actor and sing and dance my way into fame, but realized that doesn't pay the bills, and that I like nice things. So went to school, wanted to be a doctor, couldn't get into med school, so kept taking degrees and got really educated, microbiology, lab medicine, all that kind of stuff. And then finally got into med school, loved it, trained as a physician. And then no one, worked in Miami, Florida, trained in Miami, Florida. And then the stars aligned and I somehow ended up in Winnipeg and then fell in love, moved here, that whole story.
You did something in Phoenix, right? Didn't you?
Yeah, Phoenix or Arizona. I worked at the Betty Ford Center.
Okay.
In Palm Desert.
How long were you there for?
About a year. I also thought I was interested in addiction. So my ADHD is strong. So I like lots of things. So that's where I found general practice. So I thought I was going to be a surgeon and all that, but I like doing everything. And then long story short, found general medicine where you can do everything.
Yeah.
So you do a little bit of addictions. I do obesity medicine, women's health, all that kind of stuff. So yeah. So I took the long way, but ended up here somehow. So, and love it.
How did you know that medicine was where you wanted to be?
So I have your typical med school interview question where I grew up with a terminally ill parent. So my mom, who died when I was 11, had some health issues, and I saw how medicine and supportive medicine was a huge thing for my family. Yep. And just really kind of thought that was an amazing thing, being vulnerable and having those kind of amazing people and like help a family and help someone so much that I thought that's what life was about. So I liked acting and I liked all that artistic stuff, but at the same time, I liked math and science. That was always my backup plan, math and science, good backup. So.
Yeah. I'm going to be a mathematician, maybe an actuarial mathematician.
Oh gosh, there's good money in that. Do that. Yeah,
there is.
Yeah, do that. Yeah,
I know a few of them.
Yeah.
And actually the ones that I know, generally actuaries are supposed to be really weird.
Yeah, they're not. Me too.
The two that I know, phenomenal.
I'm with you.
Normal.
Yeah. You can carry a conversation.
One's a pro poker player as well.
Oh, wow. Card counter.
Figure that out.
Yeah. How does that work?
Look at that. Okay, so you knew medicine was it. You kept trying to get in. You finally got in. Yeah. You did all that. Why Winnipeg? How did that?
This is where the dirty truth comes out.
Yeah.
So I'm a foreign doctor. So Canada doesn't like us. No offense to the Canadian healthcare system. So
because you trained
in the
outside
States, in the
Canada,
States, yeah.
Right.
So when you train outside, it's very hard to get into Canada. So like you apply for any job and you take it and you say thank you. Mm-hmm. So I finished medicine in the States just as Obamacare was coming in, and that was a very scary time to be a new doctor because you didn't know if you were going to get paid, how were you going to get paid. We saw a lot of like senior doctors that were training us like panicking and selling their home and moving, taking their kids out of private school because they're like, when October 15th comes, we have no idea how we're going to pay our bills. because they didn't know their pay scales and all, and they lived a career making a certain amount of money.
Right.
So it was kind of one of those things. So I was like, I'm jumping ship. I'm going to Canada.
Yep.
Applied for jobs all across Canada and got one in Dauphin, Manitoba.
Dauphin.
Yeah.
Dauphin's
well,
lovely.
actually, the funny story is there's a YouTube video, or there's a video out there of me. So the residency match happens at a certain time on a certain date, and everyone's checking their emails, clicking to see if you get a congratulations, you have matched too. So I interviewed all across Canada at every program across the country. Was really hoping to get to the East Coast to be closer to family. Anyway, so I opened mine, and my sister was with me, and it pops up, and it's like, you've been matched to Parkland, Manitoba.
You had to look that up, didn't you?
I had to look it up because I was like, I never flew to a place called Parkland. Like, I do not remember interviewing for a place called Parkland. Well, that is the Dauphin program. And when you look it up, it's like a huge white mass. Like, it's a huge area on the regional health authority. So I thought I was going like to the northern remotest part of Canada. So I moved here with a truck, snowmobile, ready to go.
Warm jacket.
One jacket that from Miami that was not appropriate. Everyone's like, get a can of Goose. I'm like, I can't afford that. I'm a resident. I had like my R&Co like $240 wool jacket. I'm like, I got it. I'm ready for January. And so moved here. My first year was in the city. Paths align.
Like first year was in
so
here or in Dauphin?
Trained, no, Winnipeg. So the first year you train in Winnipeg because you're at HSC, St. Boniface, all that kind of stuff.
Yep.
And I didn't have to go to Dauphin until the second year. And then stars aligned, there was a job opening. I may or may not have fell in love with a young gentleman that came in as a junior doctor and then stayed in Winnipeg. And our goal was to do our return of service and go to East or West Coast. But now we own a home and businesses here.
Where's Rob from?
Victoria.
Okay.
So he's from the West Coast. He's
East Coast meets West Coast.
Yeah, and then we met in Canada, and then now we just stay in the middle.
Yeah, that's fair.
That's kind of how we do it.
So no time in Dauphin.
I did a week.
That's probably we love Dauphin, but Dauphin was great. The hospital was amazing. And then I did a month in Winkler. That was another eye-opening opportunity. I actually really liked Winkler. Really good fishing up in Dauphin.
Yep. Lots of outdoor sports for people that do that.
Yeah, I was gonna say on my digging, I found that you were an avid fisherman.
Oh yeah. No, that's
that
not
never
true.
happened.
No, I can't kill animals.
Yeah, that's fair.
Humans maybe, animals no. Yeah, but
Dauphin was that's a jail town.
Is it?
Yeah, that was the big thing. Like everyone, and then it closed.
Huh.
So
when I went, it was like the hospital took us out and we went to a Smitty's for wings. That was the big we need to schmooze you. Here's whatever kind of wings you want on us at Smitty's.
And you were sold.
Yeah, and then Winkler schmoozed with the Boston pizza, but I think that's in the Morden area, which is evil, the Winkler side. But yeah,
I try not to get it. That's East Coast, West Coast, down.
Oh,
the
down
States,
there. Oh
right?
yeah, big time.
No, not good.
Yeah, don't mix.
Okay, so we've got kind of that. You started then working in Winnipeg.
Yeah.
And how long were you working before you knew that you were going to start something
in aesthetics?
I
always knew. So in the States, what a lot of us do is we would do something called moonlighting. So residents in the States don't get paid very well.
Okay.
And so most of us do side jobs or moonlighting. So depending on what you do, some people do shifts in Emerge or ICU to cover overnights, and it pays well.
Yep.
Anyway, so I worked in aesthetics. I trained in aesthetic medicine because I liked it. Kind of going back to the artistic stuff.
Was that in school or?
Yeah, school.
Okay.
So it was one of those things where it's you can work a Saturday and make $1,000, which is huge when, that's 2 weeks paycheck.
Yep.
And so it's this is great. So I did aesthetics, and it was kind of one of those things maybe I knew I didn't want to be a plastic surgeon or anything like that, but I was this is I really liked, helping people, make them feel good about themselves, that whole kind of stuff. Mm-hmm. So I came to Winnipeg, and I remember the second I knew I needed to open something is I went to get Botox at a place here, and no offense to anyone, men's Botox is very different than women's Botox. And I had a very prominent arch after that visit that was a little more feminine than what I was going for. And I remember being wow, I need to be able to do Botox here. I was so it wasn't the look I was going for. So it was one of those things where I'm okay, so I graduated my residency and I was okay, I was dabbling. And the more I looked, there's there was a need for a certain kind of aesthetics practice here. And then, my husband is very big into the trans community and a huge advocate for them. And there was just a huge gap in the LGBTQ plus society for, doctors as well as aesthetics that knew how to work with the community and wanted to help the community. So one thing led to another and Form came about.
Crazy. So Form Aesthetics is the business that you started because you saw a need for something that was lacking in Winnipeg.
For sure, yeah.
You have a partner in it?
Yep, Corinne Patterson.
How did that come about?
That's another fun story, actually. So it was kind of like Dr. Patterson is an OBGYN here and was working at St. B. I also deliver babies. And it was one of those things late at night where we were kind of talking about women's health, and I had sent a patient to her that had some urinary incontinence after babies, and she was young, and I sent it to Dr. Patterson. We were kind of discussing the case, and like surgery was an option. I'm like, at this time it was probably, 2019 maybe, or even before then. Anyway, somewhere around there. And I was like, there's nothing to do for like a 33-year-old mom of 3 to help her bladder control. Like we have to do surgery. There's nothing else. And that just kind of led to us looking into non-surgical procedures for women's health. And that led to EMMETT, which is the technology we use for our vaginal treatments that help with that kind of stuff. And then it kind of just turned into like, oh, there's not a lot of people doing women's health and vaginal sexual health for women. And I want to do aesthetics. Maybe we should partner up with a sexual health aesthetics theme. And one thing led to another, stars aligned, cards fell properly. And
how long did that take?
Oh, wow.
From like conception to September 21st when you guys opened.
So probably a good two years. During that time, that was about a year of like pop-ups. We worked like one day a week at Bear Sugaring. We kind of rented a place there for a while, and we're doing like these Saturday things to kind of build up clientele as well as to like learn the technologies of these instruments we had bought. And then it moved from there to working out of Corden a couple days a week at another place, beauty bar. And we kind of rented space there. And it was kind of like building up your clientele all the while we were building Form. And of course, anyone opens a clinic or a business knows it never finishes on time. So it was one of these things where it's like, oh, we'll be done by May, and kept going and going. And then eventually September came and we opened and had our grand opening. And yeah, it's been a ride. COVID, opening a business 3 months before a world pandemic was not our business plan. But yeah, we've, like a lot of small businesses, we've weighed the storm and got through it and are getting through it still. But yeah, so it was a road. It was a road.
You pretty much opened up at the worst time possible.
Yeah, our bankers tell us that constantly.
Yeah. And now there's probably not much that's going to come our way that is going to be similar. Yeah. Although we've been surprised many times in the last few years.
Yeah. About science tells us we should be good for 10 years before the next one. So hopefully, fingers crossed.
So opening up a business is probably a lot different than going through everything else that you had come up to through medicine and knowing that you're going to become a doctor.
Well, everybody knows doctors are the worst business people because we're not trained. So, doctors are trained in medicine, and then you have those few that open their own businesses, but we don't do it well usually. And especially just in private practice, it's like, you have those guys and girls that own a business and hire doctors and they kind of manage it. You don't really make money at it and stuff like that. Because we don't take business courses and most of us have been pretty focused on being doctors since undergraduate. So we're doing science and we're not taking accounting and marketing and social media and all this kind of stuff.
Business development, marketing.
Yeah, we don't do any of that. Yeah. So it's Dr. Patterson has business people in her family and stuff like that. So that has been helpful, but it's one of those things where you hire good people. Like we had an amazing office manager that had a background in marketing. We have amazing staff that are younger than I, so there's just no social media. Apparently that's a class in high school now or something. It has to
young kids.
Yeah, it's like, why are we hiring?
It's intrinsic.
Yeah, just hire a 14-year-old to do your social media, basically. So we had a great team that helped us grow and still are helping us to continue to grow. So it's really great how when you surround yourself with the right people, it just kind of happens naturally and people pick up the slack and you're not sitting there being like, who's doing this? It's everyone plays to their strength. And I think that's what a lot of small businesses do, whether it's family or whatever. It's just you hire the people that fill in the gaps. And when you don't know, and like in medicine, when you don't know something, you know, someone has to kind of fill in that gap so you can go learn it or whatever. So I've pretty much stuck to the medical side, but in medical aesthetics, there's something hot every other week, right? It's like all about the neck. It's all about the jawline. It's all about this. So then you got to get training and new products and new fillers and new neurotoxins, and just never ends. So,
Right.
Yeah.
So how has the first 2 years been when you look back at it, as far as your expectations versus?
Yeah. COVID aside, because that was just, you know, no one predicted that, but like, it's been good. There's been like for someone who still works very much in the public. So I still deliver babies. I have a full, 60-hour a week general practice. Not so much now since the pandemic, but working in Emerge, and during the pandemic, working at the vaccine centers and testing sites and volunteering and all that, or not volunteering, but helping out. It's, to me, when I walk into Forum, it's just like a bit of a vacation, because there's no like, so-and-so's dying and bed 6 is not doing well. And you need to, before you get to work, I need you to swing by this hospital because you didn't sign the discharge papers and this. Right. You just go to Forum and it's like people that aren't sick and they're just trying to improve their health in a different way. They're trying to feel better about themselves. I had a patient even yesterday who's a cancer survivor that's just kind of reclaiming her life after a very long journey and doing things for her and being her best self, and things that we really promote. And so it's kind of just a really relaxing medical job where it's like, yeah, I'm performing medicine when I'm there. And one of the kind of jokes / comments I always make is like, more people cry at Forum than my other practice. Like I can be like, oh, we no longer have picking up cancer cells, or, you're no longer diabetic, things that you think would be hyper emotional for people. But for those people that make fun of medical aesthetics, I make more people cry if I do. I work with the trans patients, masculinizing and feminizing faces. For the first time in their lives, they have an outwards appearance of what they've been trying to portray for years. Or someone who's super self-conscious about a thin upper lip, or a scar that we fix, or hair removal, or something like that, someone's been super self-conscious about, having too much hair in a certain area, and we fix that. They cry and they thank us and they send us muffin baskets, and they're just like letters and bring us gifts. And it's really interesting how, every day we see 40, 60 people in your office helping cure medical issues. And you're like, okay, that's great. And there's like that expectation. Well, like, that's what you do. You're a doctor. And then you switch hats to this other job. And it's like, oh, you fixed that scar I hated since I was 11. You're a hero. And I'm like, I don't know about a hero, but
I'll take it.
I'll take it. Yeah. And yeah. Thanks so much. But here's free lip gloss. But yeah, so medical aesthetics has been rewarding in a lot of different ways. Like, I absolutely love delivering babies. I don't think there's anything more rewarding than being there when someone's welcoming something into their family. Like, you can wake me up 100 times in the middle of the night to just watch a dad cry and bury his head in the mom's armpit as he's trying not to cry while his little one's coming out. Like, that's 100% why I do it. Yeah. But I get the same thing from aesthetics when you're helping someone get over something that's been super traumatizing to them, or just been like super self-conscious about, or, they've lost a ton of weight and they're trying to like bring out that inner person. It's super rewarding, and hearing everyone's stories. It's just, and as well, it's like, it's a little more on it's definitely on the luxury side. So we talk, we chat, they have coffee. We're, there's more getting to know our patients, and like, they are dedicated to you. Like, they won't let anyone touch them. Right. It's what I assume hairdressers and stuff, like my sister, no one else can touch her hair kind of thing. I don't have hair, so I don't know what that's like, but yeah. And it's just amazing seeing, people leaving and they're just a completely different person because you fixed or altered or reshaped something that they were conscious about. So,
right.
Yeah.
Well, that's pretty much like one thing that really stuck out to me when I was looking into Forum, and even medical aesthetics in general, was the psychological aspect of it. And your website actually mentions that, and it says, a passion for educating clients to help them make informed decisions about their evolving aesthetic and sexual health. So a lot of your stuff, I imagine that when you bring people in, and the intake is probably a lot of questions
for sure
about what's going on, right? And more.
Oh yeah. Like, there's definitely that generation things, and we have some doctors here in the city that speak openly about it, and it's great information. Filters, there's a lot of body dysmorphia in our young people that are like, make me look like this filter. Like, I want my lips to look like this. And you're like, no, that's not reality. Or I want to look like a Kardashian or whoever. That's great. Form isn't 100% on that page. We're never going to do anything that's going to be over the top when it comes to changing your appearance. My staff and myself, our biggest thing is like after procedure, I want someone to be like, did you get new lipstick or did you go away this weekend? You look really good. We're not looking for those dramatic. We're non-surgical. So we don't do huge surgical things. We do non-surgical stuff. But at the same time, it's educating your patient. Like lip filler is one of the most riskiest places you can get injected. You can go blind from getting your lips injected. Really? Like the arteries from your lips go directly to your eyes. So if you don't have a trained injector doing it, six people in one of the last studies, like in 2021, I think 6 people went blind in the US from lip injections. Okay. And, in Kelowna 2 years ago, there was a very prominent tennis player athlete. She was like 23. She got her lips done, is blind in one eye now, and her entire career is over. So there are risks with this. And I think at Forum and our nurse injectors and nurse practitioners, we're all very much trained that this is medicine. This isn't something that should be taken lightly. It shouldn't be done at a kitchen table, in my opinion. It shouldn't be done anywhere but a medical facility because there are risks with it. And the education is huge on that at Forum because we want you to know there's risks, but we also want you to know we're trained medical professionals. We have all the antidotes, all the medical equipment there that's in hospitals and in medical clinics to deal with an emergency. And, we do injections. You wait around. We make sure there's no blockage of blood going to a very important organ after we treat things. And so that's a huge part, as well as coming up with actual customized plans. So like the generations of your grandma going for a facelift at 65 to look 25. I don't think that's where medical aesthetics is anymore. It's all about gradual aging, doing those procedures every 6 months, 1 year to gradually age. So when you're 75, you look 60. You look good for 75, but you look 60. You're not sitting there being like, oh, your face looks 25, but the rest of you looks a little haggard. So there's definitely kind of that change in medical aesthetics. And I think Forums embrace that because we're not about these. And, there's people that want that. And there's great people in this city that do surgical corrections and surgical fixing and cosmetics. Yeah. But that's just not what we are. I love the non-surgical aspects of helping someone live their best life, do something that's super important for them, whether it's lip filler or jaw lines, or they've lost a ton of weight and they're trying to rejuvenize their face, or they feel every time they look in the mirror, they just look tired and angry. There's in fillers ways of placing it to make that go away, as well as back to how I started it, helping the men of Winnipeg not have that overly feminine look, which was what drove me crazy and what drove me to do this in the first place.
Yeah. I think that is I think that's a story that happens more common than not is something happens to them and they're like, there's nothing that is in the marketplace.
Right. And men's a very small portion of the market. And, research shows us it's getting more and more prominent. But, even when you train, I remember when I trained, you study this stuff for, you take a course and it's a week or 2 weeks, there might be one male model. Right. And most of the people coming in are women. Yeah. And that's great. But yeah, there are men out there that want it, but at the same time, completely different look. You need a lot more Botox. You need a lot more neuromodulators because they have way stronger muscles potentially and things like that. And just like knowing how to adjust that is huge. And yeah, and it comes down to having experience, same as working on different ethnicities and things like that. We're super lucky at Forum that we have a very varied clientele. So, whether it's, and you have to be able to different cultures and have different aesthetics. So you have to be able to adjust that too. And it comes down to a very mathematical medical approach, right? So, when I first started injecting in the early 2000s or mid 2000s, it was very much like, this is artistic and, we're painting with fillers and we're using it to reshape the face. Form really takes more of a mathematical approach. Like there's calipers, we're drawing lines everywhere on your face to be like, this
symmetry.
Yeah, we're really chasing that symmetry, chasing the mathematics of beauty, which is kind of like a topic where the reason you hate this line under your mouth isn't because there's a line there. It's because you lost your volume in your middle of your face and your mid face. So we have to reevaluate that and treat that first. And it's a step-by-step approach, right? You got to fix the foundation before you go and put on the fancy doorknobs. Okay. So yeah, I could fill that little line that's driving you crazy. Probably not the best approach. And at Forum, we're very much on that educational piece, being like, if we fix the foundation and the structural part that's causing that heaviness of your skin, you're going to have a way better outcome. You're not going to have a very forward face or duck lips or whatever you want to call it.
Yeah. How's the conversation surrounding medical aesthetics? Is the conversation changing? Is it increasing? Is it the same as far as, especially with men, right? You said it wasn't very.
Oh, it's changing.
It's becoming a lot bigger. How have you found the conversation around it?
It's much more commonplace, where before it used to be very much like, ooh, I get Botox, don't tell anyone, back doors, and, medical offices not even posting their name at the front kind of thing, or like getting it done at your dentist or your hair salon in the back room kind of thing.
Yeah.
It's much more commonplace. Like people are very like, oh yeah, I get Botox, I get fillers, I get this, I get that. I got laser hair removal, vaginal rejuvenation, tightening, whatever. That conversation is much more loose lips with the majority. And I think it's also mainstream media. The Kardashians really help us out a lot when they get the new facial or whatever.
Yeah.
And social media. Like if anyone told me 10 years ago I would have to have such a social media presence to do my job, I would have been crazy. We're very fortunate. We've worked with doctors in Beverly Hills, Dr. Nikoloff at the Beverly Hills Center. And we were down there training with him and getting some experience. And he's an older guy, and he just basically was just like, you need to be on social media.
Right.
He's like, I'm not, because I don't need to be. I've been doing this for 50 years. But he's like, you need to be on social media. Because we're like, oh, how do you become the best in Beverly Hills? And he's like, I'm the best because I started when there was only 6 of us.
Yeah.
And that was kind of his approach. He's like, yeah, I see 4 people a year, like a month maybe, but they're the 4 people that I've been working on for 20 years kind of thing. Where he's like, new people have to have a social media presence. And like, even with the companies that we work with, 100% you're credentialed based on your social media presence, how many followers you have, your work that you post online.
Wow.
Like that's how people credential now. They're no longer asking you like, where you go to school, what courses do you have, show me in the old days, we used to have, literal pictures and, flip through my picture book, or these are my before and afters.
Yep.
Now it has to be online. And like doing sexual health, that's hard for us because we don't want to get arrested for certain pictures, as well as we run into the thing where a lot of our clients don't want their picture before and after pictures.
Right.
And a lot of men don't want their before and after pictures. Or if they come in for a P shot for erectile dysfunction, probably not going to post that on there either. So the world is expecting us to have these pictures and to credential yourself online. We work with that, and we're trying to always evolve and be on top of that, which is hard for me because in general, I don't have a social media presence. I'm just not that person. I missed it just a little age-wise. And I hate computers. So they're not my friend. So yeah, but it's, we go to these huge aesthetics conferences, and it's like half of it is about social media. There's like, I would say half of it is the science, and a quarter of the rest is like social media presence, how to take before and after pictures, how to credential yourself online, how often you should be posting on Instagram and Twitter and all this. And it's like, oh my God. And you're like writing it all down. And, what time of day do you put up a post? And like Mondays before 2 and Thursdays, the science tells you at this time. And I'm like, okay, I'll stick to the medical side and I'll let these other people take over that. But it's good and bad because, I always say the adage of there's 3 sides to every story, his, hers, and the truth. Sometimes we look at before and after pictures online and it's just like, that's not possible with what they're saying. Cause who knows, because it's also the big part of the education. It's a step-by-step approach, right? You need to have good skincare. Cause if, why give me $4,000 to give a bunch of fillers and stuff if your skincare game's not there, right? So if the canvas isn't great, why paint an amazing picture on it? So the education part is building that relationship first. Like, oh, this is what you're unhappy with your face or your body. Great. Here's what we can do in the next 2 weeks, 6 months, a year, 5 years to get you to where you want to go.
Right.
Sometimes we have to be like, oh, what you want is impossible. You should go see one of our friends in cosmetic surgery or plastic surgery. Or that's an unrealistic goal for this visit. But at the same time, it's like, get them on some great skincare, get their skin looking good, then start correcting some of the things, starting with the foundation. It might take 5 or 6 visits, and it might take 6-7 months to a year, but it's all that variability of it. And it's also the education piece. Like people are like, ooh, 2 fillers, that like 2 syringes, that's a lot. Well, it takes 7 syringes to equal a packet of ketchup. Like before my wedding, I had 16 syringes put in my face, and nobody knew that I had 16 syringes put in my face. You know, it's all about the science, knowing where to place it, knowing where to lay it, how to lay it, all that kind of stuff. And that's why I think you need to really, whether it's at Form or another aesthetics clinic, you need to make sure your injectors know their stuff. Because, you know, here in Manitoba and in Canada, and, you know, we struggle with the credentialing part of it. And, you know, there's the College of Physicians and Surgeons of Manitoba are making huge changes to, you know, as of January 31st, there's huge new laws and changes of where you can actually perform as doctors medical aesthetics. You can't work out of your home anymore. You can't work at it. You know, there's a certain, it is medicine. You have to have a clinic now and certain things like that. And we're going to see that ripple effect through the College of Nurses and nurse physician or nurse practitioners and things like that, which I don't think is a bad idea, because I think the problem with aesthetics, and we've seen this in Toronto and Vancouver, and some of these horrible cases are, you know, people are going into people's basements thinking they're getting a deal, and they're getting like silicone injected from the hardware store from someone who says they're credentialed and they have their online credentials and they have a huge social media following. That's not super healthy. And as you know, when people come in and they kind of ask for a discount, or we're like, ooh, that's really expensive, my kind of knee-jerk reaction is, do you ask for a discount on your blood pressure pills or your contraception? You know, this is medicine. And when we look at it as medicine, it comes with a price tag. And you know, we're not trying to gouge people or whatever and all that negative stuff. But at the same time, it shouldn't be discounted, because you should want a medical professional to do it. You should want the years of experience is what you're paying for. You're not, you know, someone who took a weekend course and all of a sudden is like, yeah, I got credentialed online and now I'm going to start injecting out of my house at my kitchen table. Those should be red flags, in my opinion, when it comes to medical aesthetics. But we do it all the time. We see it all the time, right? Or we have people that come in and we have to do some fixing, and they won't really tell you where they went. And all of a sudden it kind of comes out. They're like, oh, well, my friend was learning. And I'm like, ooh, what part of that was said, let's do it. But, you know, to each their own. But at the same time, we were all learners. I remember the first time getting Botox from a person whose hand was shaking so badly that I'm like, just don't hit my eyeball, like helping steady their hand kind of thing.
You know what?
So,
I'll do it.
Yeah, just I'll do it. And now you push the syringe. Yeah. But yeah, we all learn.
Have you ever seen that picture online, and it's like, you can always get it cheaper?
Yes.
And it's that horse that's like the beautiful horse. And then the second one is like the stick figure horse.
Totally.
You can always get it cheaper.
You can. And
somewhere.
And the thing about aesthetics is like, and yeah, to take that analogy a little further, it's like, in Canada, we really have a very small toolbox of products. We have 3 or 4 big companies. They provide all our Botox fillers, neuromodulators, all that kind of stuff. So we all have the exact same thing when it comes to it. But seeing what the hand of the practitioner does is huge, right? Like sometimes, you know, you see posts and it's like, these lips took 3 syringes. And I'm like, where did they put it? Because I don't know how that look happened. Well, if you put it deep enough, I can charge you for 3 syringes and you'll never see any volume in your lips. But if you're using science and know how to ethically put it in an appropriate manner, half a syringe can make your lips look amazing. So always look for that. And I think, you know, even seeing my family that don't live here and they go see other people and they're like, who do I go to? I'm like, yeah, go to social media, see whose work you like. But at the same time, get educated. Go see 2 or 3 people. See, oh, I connected with this person. I like kind of their ethos, or I really like how they approached it. They taught me a lot. Or maybe you don't want to be taught. Maybe you're like, wham, bam, let's move. I'm on my lunch break. I don't got time to chat. And we have those people at Form too, right? They're just like, yeah, I got 30 minutes. You got go. And I want my Botox. So yeah, you really gotta do what's right for you always. But at the same time, you should be educated. You should know just as much about Botox and fillers as I do when you're getting it, because I'm putting it in your face and it's going to last 6 months to 2 years. So you should know where it's being laid, how it's being laid, why you're doing it. You should ask lots of questions. You know, our consultation fees, we don't have any, because if you're not educated, you shouldn't be making the decision to go through with a procedure, right? So that's how we look at it. But
everything you said correlates perfectly with what I tell people who generally don't live here in Winnipeg, what kind of builder, like who should build my house, right? It's exactly the same. It's go see who you connect with, see you like, listen to their stuff, get educated by their stuff. People should be providing content, right? As far as educating people so they can. And
you shouldn't be ashamed of it. You should be able to, like, in my public practice or GP practice, right now with the world we live in, tons of people needing therapy. You should, if you don't like your therapist, move on.
Yep.
If you don't like your doctor, move on. You know, I'm a very forward, kind of laid back doctor. If you don't like me, that's great. Move on, find someone that you really connect with, because then the relationship's easier. You're not pushing it further. And that's what I tell people, because I see it a lot being like, oh, I went to my employee assistance program. I got a therapist, didn't really like them, but I stuck with them for 10 seconds. I'm like, oh, if you don't like him, it's like dating. If you don't like it, move on. It's like swipe left or right or whatever it is. But like move on, because if the connection's easier and you like the person, it's an easier way to dance, right? You're like, oh, I don't really like those windows you picked. Well, I picked those windows because it's the best for Winnipeg.
Yeah.
You know what I mean?
Yeah.
Or, whoa, because a lot of times people are like, well, what would you put in my face for fillers? And I'm like, oh God, don't ask me that question. You know, we all have our biases for sure. But at the same time, it's like, they're really all the same science. They're all hyaluronic acid linked to different kind of proteins. They last a different amount of time, that kind of stuff. You know, there's certain product I like in certain areas for sure. And when people come in and they're educated, it's kind of like, that's our win-win. When people are like, I trust you. You're the doctor. You know what's going on. Yep, this is how I'm going to do it. This is how much it's going to cost. And this is the product I would use. Boom, great. And then you have people that are like, well, I heard this is on sale and I want this. And it's like, well, that's not the greatest product for what you're trying to do.
Yep.
And once again, I think if anyone's educated, they can make that decision, right? So if you're like, well, if you tell them why it's not a great project, I don't have to do any work, because they're going to like, oh yeah, I don't want that in my lips, kind of thing.
Yeah. I also find it helps a lot more when I have somebody come in. I want them to have done a little bit of research. I want them to know things, because that makes my job. I don't have to start from scratch, right? When I'm educating them, as far as even when we choose, if we use the windows examples, if someone's coming in and they say, I just want you to pick the windows, and we pick the best ones according to the architect and the designer and you know, the color palette and everything and then they come in and they're like, that's not what I want.
Yeah.
And you're like, okay, so let's talk about it early on. Let's make sure that
make sure everyone's on the same page, right? Yeah,
that's right.
And that's always, because we see a lot in aesthetic medicine. It's like they always want to come with their friend, and then when their friend's in the room, they have questions, which is great, and you should have tons of questions. It's like, well, maybe I want Botox too, or maybe I want filler too. It's like, okay, but you should come for your consultation, you know. And of course, there's always making exceptions, right? Like, oh, you're here now, let's talk, whatever. So I'm over dramatizing it a bit, but you should be educated. If you're making a whim decision, like how many people woke up one day like, yeah, I'm going to get a breast augmentation. Let's just do it right now. That's just not a thing. So why are we treating fillers and Botox like that?
Right.
Just because they're shorter term doesn't mean you shouldn't be taking it that. And same thing as with, once again, I know we're not talking about it, like general practice. You should know what blood pressure pills you're on and why you're on it. And maybe how they work a little bit, maybe not the biochemistry, but you're like, oh, I'm on this pill and I shouldn't mix it with this because this happens. You know, like my old man, like I roll my eyes so hard because I'm like, what pills are you on? He's like, well, the 2 white ones and the blue one. I'm like, that's not how you answer that question. And I tell that to my patients too.
You can't take a white one and a blue one together.
That's
what are you talking
Everybody
about?
knows that. Yeah. Or like, I take the one that looks like a little house. And I'm sure every doctor who is listening knows what that is. It's a muscle relaxant, but it's shaped like that. But it's one of those things where it's like, you know, if you ever, God forbid, have to go to an emergency room, you should know what pills you're on, and you should be able to reproduce that, because it's definitely going to change the outcome of potential medical problems. And it's the same thing with, oh, I don't know what filler I had put in my face. You should, you know, if you paid someone money, a lot of money to put something in your face, you should be educated enough to know. And I think that's where the educational piece always comes in for us, because it's like, we put this in your face because of this, and this is the reasons, this is your expectation. And anything in medical aesthetics is expectation setting, right? Like, I know you want to look like that. That's great. And we might get there, but that's not what's going to happen today.
Yep.
I'm not going to take your lips from like 2 little lines to like full blown Kylie Jenner overnight. That's a process that takes years to get there.
Right.
It took years for them too, even though you wouldn't know. But
you touched on that, and I love that you said that, is that the expectations. So from a business owner, from a doctor working on someone, to any business really, is setting expectations. I mean, you could easily, this whole thing of buyer's remorse, right? Like,
we see it.
My God.
Yeah.
But expectations are the biggest thing.
Oh, totally. And then like in general medicine, like we do that all the time, because not that like patients have the right to be upset, but you sit there and you're like, yeah, but we talked about this.
Right.
And they're like, right. Because there's always going to be that like, oh my gosh, oh my God. Like the best example is lip fillers. There's like within the aesthetics community of injectors, we all know there's like the 5 levels of remorse because people, hate it immediately because they're swollen and they're like, take it out. This is way too much. It's way too much. And then like day 3 through 5, there's tons of lumps and bumps and they're just like, no, I want these dissolved. It's not what I want. Around the week mark, there's maybe some still bruising and they feel really big. And then like around the 2-week mark, the swelling goes down and all of a sudden they want to come back because they liked what the swelling looked like. They're like, I want them like they looked like on that first day. And you're like, you called me every day for a week being like, I hate my lips, dissolve them, make them smaller. So, hopefully in that forum, we try really hard to never get those phone calls because when you leave, we go over everything that's going to happen, every possible complication, which can stress people out.
Yeah.
Like we're about to inject around your eye. You could go blind. Are you aware of that?
Right.
Or noses, a lot of people don't inject noses because it's in the danger area of making you permanently go blind. So it's one of those things, if you're highly educated and trained, it's not scary, but at the same time, you should know that there's a complication there and it might happen. So, I would hope your injector or your professional has already educated you on that because we take people to surgery all the time in the hospitals. You have a 50% chance of making this out or setting the risk that like the outcomes could be this or this, you might get 20% improvement or whatever. And it's the same thing in aesthetics. I would love to say you come in, I could like shoot a little needles in there. You'll never have a wrinkle again. You'll look 20. It's probably not realistic. And so setting that expectation just makes it easier on everyone because you're not getting those complaints. You're not getting unhappy people coming in like 2 weeks later being like, I hate this. I thought this was whatever. And that's also kind of when you do get those patients and you come back and you flip over the before and afters and you're like, look, and they're like, that's me. Because you're living it, you're seeing it every day, right?
Yeah.
But then when they see those before and afters, it's like, yeah, this is what we talked about. And that's also kind of one of those like swoosh moments where you're just like, oh yeah, that felt good. Kind of like showing them the before and after.
Throw my cape over here.
Yeah. Mic drop.
Welcome.
Yeah.
Man.
You get Botox. Yeah.
Why do you think a cosmetics or a aesthetics clinic would fail? When you look in your worst, when you're having
a pandemic. That's a good one. It's, I think because it's so varied. So here in Winnipeg, it's varied because a lot of medical aesthetics places are paired with a plastic surgeon or a dermatologist. So there's like 2 businesses in one. Okay. So form is different in the fact that we only do medical aesthetics out of there. And I think one of them is possible reasons it could fail is, I wouldn't say not so much doing your homework, but understanding the patients and the clientele, right? Because what's hot right now, much like fashion, much like anything that's trending, it could be over in 6 months, right? So Brazilian butt lifts or body contouring, it's hot right now. Well, there's a huge cost for us, like the lasers, the treatment, the training, all that kind of stuff. That could be hot for 6 months. You might never get your return on investment. And then people are like, oh no, flat butts are in. I don't want any bubble butt back there. And it's like, oh, but I just bought this machine. So I think going in and knowing, so what we, one of the things we really focus on is, we do a little bit of everything, but also kind of like your tried and trues are always going to be there. There's always going to be people that want hair removal. There's always going to be people that want sexual medicine because sex is great and you should be having sex. But if you're not comfortable or you have an issue down there, it should be talked about openly and you should be able to make those corrections. So that's really important for us, as well as Form is big on the evidence. If we treat, Dr. Patterson and I, everything at Form is very much show us the research, evidence-based medicine. That's both what we practice in our private practices as Dr. Patterson is an OB gynecologist and me as a family medicine. We only practice medicine that there's research that it works. I give you a pill because I know it's going to lower your blood pressure. I do a procedure on you because it's going to improve the outcome of your baby. That's how we work. So that's how aesthetics works for us. So we have nothing at Form that needs to be done by a doctor. We have nurses and nurse practitioners there, but they can do procedures only while there's a doctor present. Our laser hair removal is at a level that when that machine is on, there has to be a doctor present because there's negative outcomes. It can burn you. It can blind you. There's huge variations. And that's also what makes medical aesthetics so iffy, is because there are the machines that you can buy on Amazon to do at home. They're great. You might get there after 100 treatments because they're not very strong. but that there's the big boys that cost a lot of money and you need a lot of education to use them and things like that. So I think some reason things fail is because people just jump into what's hot, right? So it's like, oh, everyone wants to be thin. You throw these pads on and you'll have a 6-pack in a week. Well, the evidence on those machines isn't very great. Someone like you who's already got a 5-pack, yeah, we probably get you 6 or 7 with that machine. But if you got a keg, we're probably not going to turn that keg into much. And if we do, it's going to be a lot of treatments over a very long period of time.
Right.
So I think when I see, my colleagues in other provinces and, I'm really fortunate to have a great close community of other practice owners. We're always talking about like, oh, did you see this new machine or this new treatment that came out? What do you think about it? And of course, everything for me is like, show me the research. Or we have someone that comes in being like, I represent this machine. I think you should buy it. It's great. Da, da, da. It's like the first words out of my mouth are Dr. Patterson's is like, can you send me the research on it? Is it reproducible? Yeah. Same as our skincare line. It's a prescription only skincare line. It's a Canadian product. It's almost vegan. I'm doing bunny ears right now because it has honey in it, which means it's not vegan in some of the products. But there's no animals in it. So I call it vegan. But it actually, in dermatological studies, they take skin biopsies and look under microscopes. It does increase collagen. It does do what it says it's going to do. Okay. So that's why we support it, because I can do it because the science is there. Other things and lotions and potions and creams and procedures that don't have that evidence, I just can't back because I'm a doctor. And I think that's also something in the aesthetics world because, I see other clinics and every time I travel, it's one of my favorite things to do is like, look who's local, or you're walking and you see these poster boards of the things, or my friends will be like, I'll get texts constantly being like, what do you think of this thing? I just heard about this new laser or this new light treatment. And I'm like, yeah, that's hot right now. It's all over the Instagram and social media and the TikToks, but there's no science behind it. It might work, it might not work. Yeah. But for me, I don't want to take people's money or do treatments on people that might not have that outcome because they're not going to be happy. And if they're not happy, then I'm not happy. And then it just leads to a whole bunch of other issues, right? Yeah. So really not doing your research on the science, but that's also kind of my personal ethos and Dr. Patterson's when we started Forum was to have that strong foundation of, everything in medicine, reproducibility, the science, the evidence-based medicine. If there's no evidence for it, I just don't want to do it. Like trust me, I've had treatments done at other aesthetics places that I'm like, I just want it. Like make my skin look perfect. Yep, that's great. Oh, it didn't work. Oh, I didn't think it was going to work because there was no research on it. I'm not disappointed. But when you have people come in that, are paying a lot of money for something, they're expecting that result to be blank. And so, yeah, and I think that's, when I see my other coworkers and friends that are opening clinics and stuff like that and kind of jumping on what's hot, that's where my nerves kick in for them. Cause I'm just like, I hope that's still hot in a year. And, some of them have hugely successful businesses, right? But like buying one laser or one machine that does one specific thing. Sure. Like I suffer from canker sores a lot when I travel. It's a little personal, but there are light therapies out there for canker sores. I would love to buy that machine. Am I going to buy a $200,000 machine to treat a canker sore twice a year? No, I wish I had the money to do that. But are there other people out there? Well, maybe there's other canker sore sufferers out there. But I think the biggest thing is having too many treatments, diluting yourself. And that's why we have a very specific thing, right? It's injectables, non-surgical aesthetics. We don't do surgeries. We don't do anything cutting or any of that kind of stuff. We know what we are. We do it well. We pride ourselves on that. All our education is within that realm. We don't do 100 things. We do, 20. I'm making these numbers up.
It's like the restaurant that has 250 items on
Cheesecake
the menu.
Factory with that binder that you fall asleep halfway through it. I don't even know what's past page 3.
I can't do this.
Yeah, I only ever eat appetizers because I fall asleep by the time I get to the
7th page of appetizers.
Yeah, I'm just like, that looks great. A salad bigger than my head. Yeah, I can deal with that. So and I think that's aesthetics too. And I'm not saying anyone that offers multiple things, because you could have a huge staff, right? You could have 15 doctors each specializing in a different thing. Sure. So that's great too. But yeah, that's what I think is the biggest kind of when people open new clinics, Botox and fillers, we know our stuff, right? You can open those clinics pretty much anywhere and we know how to do it and all that kind of stuff. It's when you get into the realm of medical aesthetics or you go to these aesthetic shows, like the Vegas aesthetic show was just not too long ago. There's a laser and a machine for everything. It can tighten and loosen whatever you want. is there evidence behind it? Because how are you going to back that up with your MD after your name, or just being a good person and being like, oh yeah, you should totally get this. It might not work though.
Right.
And that's where I have a hard time with it.
So it seems like even if the research is there and it shows that a treatment works, now you guys are playing kind of the trendy risk reward of, is this gonna something that's gonna last? Is it not? Like that's because it could be one celebrity, one famous person, one treatment that goes botched, and then that treatment's no longer okay because of how social media works, right? Yeah.
And, is it true? What are the other factors that went into that outcome? We do, and like one of the things, like the cool sculpting, body effects, fat removal things. It's great if it does work, but are you on a good diet? Are you exercising? Like if you're not making any changes, but you're getting this done, it will shrink your fat cells and remove them.
Yep.
But then if you gain 20 pounds, you're still not going to have that outcome you wanted. So it goes back to the education thing, but it also goes back to like, I remember when I started in the aesthetics world, like there was just certain treatments that were so hot, right? Like everyone was getting ablative lasers, basically like deep heat burns to your face to regenerate. And you had to wear Vaseline gauze and you looked like a mummy for a month, but your skin looked amazing afterwards. All those scars were gone. That was huge. You really don't see that now unless someone has horrifically scarred skin from like severe acne.
Okay.
We don't do that anymore. And like I joke at Forum all the time because I'm a big lover of chemical peels. I think they're the best way to have amazing skin. Little dated for sure because we've moved on to a lot of these advanced light therapies. But if you know your science, you can make a chemical peel have the same outcome, and you're not going through these like healing processes or where you scare small children when you go outside.
Right.
And so things just go in waves of what's popular. And then for me, once again, and Dr. Patterson and everyone at Forum, we know these things work and we know how to manipulate them to make them work for each of our patients. So, and I think that's also one of the big things when people do open new businesses in any shape or form. It's like, know your stuff, know it well, because then you can, make it work to your advantage, right? Like, oh, I know you came in looking for this treatment, but what you're asking for would best be treated with this.
Right.
And that's how we play. And like, I'm very open and Forum is very open. Sometimes we do send you to our competitors because we're like, we don't do that here. Wait, I understand what you want and we do offer something, but what you actually have on exam is better treated surgically. You actually need your eyebrows removed surgically. You need a blepharoplasty. I can lift your eyebrows a little bit, but where your expectation is not what I can do. So here, let me send you to a referral to one of our, cosmetic or plastic surgeons or ophthalmologists. Yeah. So I think that's also a sign for us or for anyone being like, oh yeah, know your limitations. Like I have no problem telling people like, oh, you need to go see someone's.
Well, you're being an advocate.
Oh, totally.
For your patient, right?
And like even in our office, like sometimes some of the other injectors and nurse practitioners will send, men to me. They're just like, oh, he wants a jack jawline. You do them better than me. Great. And I know certain lip styles that people want. I'm like, oh, go see our nurse practitioner. She loves lips. Like that's what she really likes.
Right. Yeah.
And I think you play to everyone's advantage in your business.
Yep.
And, I like jawlines. That's just a me thing. I know how to do them well. That's, I love doing full faces. Just doing lips or just doing something. I like doing the whole like, wham, bam, thank you, ma'am. Kind of like, ooh, that's a nice look. I like lots of...
That's a Leon face.
That's a Leon
I know
face.
that
Yeah,
face.
yeah. It's just written all over it. And I really enjoy doing hands. That's my other thing. We all have those things we really like. So, play into your strengths but I think everyone does that naturally anyway. But I think the opposite is where people struggle being like, ooh, I don't do that a lot, but I'll do it. Yeah, I'd rather send you to another person that does it a lot and has really great outcomes. Because I think you're more likely to come back to me for my opinion on other things. And that's how I play it personally. But.
I lost my hand modeling career many years ago when a stucco mixer and I had a fight.
Okay.
And it won. And this is now this is a podcast, so you can't really. Oh. But yeah, it's
still pretty.
This is what actually really pushed my entire career into a different direction.
Oh, wow.
Because this started asking, the question kept playing in my head. There's no one-handed firefighters. Right?
Valid.
And what would I have done if I would have lost my hand?
Oh, totally.
And then I was like, okay, you need to do something
It's the whole
better.
reason I don't downhill ski. Because if I break my hand, I'm screwed.
That's right.
I know. My husband's like, you got to learn. I'm like, no.
Do you have insurance on those things?
kind of, but like not like people think, like Lloyd's of
not
London.
like David Beckham.
Yeah, exactly. They're not worth that much, but like I can't deliver a baby if my hands don't work properly or whatever.
Yeah.
And I always get, my husband's a huge downhill skier, loves it. I've tried ski school several times. I've never fallen, but I'm done because it's not exciting. Because the whole time I'm like, yep, if I run into that tree, I'm dead. Or if I fall, or I go over that cliff, or like, and then you just see these little kids that don't care because they're not thinking.
Yeah.
And I'm like, that's when you learn to downhill ski.
Yeah.
When, you know, your bones are still bendy and you don't care. You can't learn how to downhill ski in your 30s because that's just anxiety provoking.
Yeah.
So I praise ski.
Don't look at something that you don't want to hit.
Yeah, exactly.
And then you're like, God, I'm looking at the
Why am I
tree.
going
I'm going to
that
hit that
way?
tree. I hit the tree.
Yeah. And now my life is over. And can you
Yeah.
please get me to a good hospital? Yeah. That's things that go through my head. Yeah.
Very fair.
Yeah.
What are some things that you wish people knew in general about medical aesthetics that they don't? Or one thing?
Yeah. No. So hands down, my biggest thing is that there is a risk with everything we do.
Mm-hmm.
You know, we can't predict outcomes like anything in medicine. I could prescribe you a birth control pill and you could have a negative outcome. I could prescribe you a hypertensive or
Tylenol.
Yeah, exactly.
Right, yeah.
I don't know you're allergic to something until I give it to you. That's a very common thing. And so the same with aesthetics, knowing that fillers can permanently blind you, knowing if it's not done properly, knowing that you could have a bruise that lasts a long time.
Yep.
Anytime we break the skin with a needle, you could get an infection that I can't predict. I'm going to, of course, clean your skin and do it in the best way possible. But there's a hole in that skin layer now that an infection can move in. And when that moves in, we have potentially bad news bears trouble. There's a chance that your anatomy isn't 100% like everybody else's, but we don't do MRIs and ultrasounds and map your face out based on your bone structure. I know where your artery should be, but maybe you were made on a Friday and we were in a rush and it's a little bit to the left. I don't know that until the needle's in there. So there's always those risks. And I think that's why highly educated, highly trained people are 100% needed. I'm not saying that not everyone is, but you should be asking those questions because, you know, you always get that thing just as, you know, you clean the patient's skin, everything's signed, pictures are taken, you've educated, they've come back or you're ready to do the treatment and you're about to put the needle in. They're like, this isn't going to bruise, right? And I'm like, well, it could. This is how a needle works kind of thing. And they're just like, oh no, but I got to go to work. I can't have a bruise. And I'm like, all right, I can't 100% guarantee that because it's a thing. And that's kind of on one spectrum. And then the other spectrum, like when people come in like, oh, I've had fillers done tons of times my whole life. And then when we do our general spiel and they're like, what do you mean I could go blind? Or what do you mean I could like block the blood supply to my skin and like my skin could die?
Yeah.
That's a legit thing that happens. Like it happens every day somewhere in the world. And they're just like, oh, I don't think I'm ready for this. And I'm like, or Botox, it's pretty harmless. But at the same time, there could be a nerve in the lower part of your face. And then all of a sudden you can't smile for 3 months. That's a thing that can happen. And we know where the nerve should be, but 33% of the time it's not where it should be. And then you look like you're a stroke victim, unfortunately, for a while, but it's not long lasting. So that's the biggest thing. And I think that once again comes back to education, but there is a risk with these things. And I think film, society, TikTok, social media, it's like, oh, it's no big deal. I get Botox, I get fillers all the time. Yeah, it's not a big deal, but it's on the same realm as surgery. Like there is complications. There's nasty complications with this stuff. And of course, one quick Google search of like lips gone wrong will make you never want to get filler. But then I have tons of questions. Was it done by a trained person? Where was it done? What product did they use? Was this person trained enough to have all the antidotes, if you will, in their office to deal with it right away, to get the blood perfusion back right away? We do. And most clinics, all clinics do, medical clinics for sure do. But is that a thing? And so having that is huge and understanding that. And I think patients have the right for due diligence, but they have the right to ask. But I think that's the biggest thing lacking in medical aesthetics because everyone's, oh yeah, I saw, I get this chemical peel, I'll look like this. Well, that's what happened to that person. It might not happen to you. That's right. If you go to the wrong person, you can get a permanent burn. You might have a rare like allergy that causes you to swell up. And that's the other thing I always push back on some people. Having a doctor or a highly trained medical professional, they can treat the complications, right? Where, an aesthetics clinic that's, not medically trained, it's like, ooh, go see a doctor. That's really bad.
Right.
It's like, okay.
Ooh, someone should do something about that.
Yeah, you should really get that looked at. We are the people that, and that's why, we have a 24-hour doctor on call for everyone at our clinic. And I think most clinics do, but always push that question because that's what we see internationally. Like, Toronto's had some horror stories of like, non-official clinics and people promoting to be doctors when they're not. And, there was the case where there was a woman doing butt injections, and it wasn't until with silicone that was from the hardware store, and it wasn't, and come to find out she was 20, she wasn't a doctor, all her certificates were in another language, but people just took it for granted. And people were getting these injections for $5,000 that should be costing $30,000, but she did tons of work, but it wasn't until several people with complications went to the same emergency room when the same doctor was working that they started putting two and two together. And, and eventually, and now it's like a whole legal case because like she was misrepresenting herself, but she doesn't fall under the realm of college and physicians because she's not a physician. So that stuff is out there. And so, do your research.
That's crazy.
Yeah.
On the business side,
okay,
right, you still had to open a business, right? So what is some advice that you would give someone, not only doctors or medical aesthetics, but any business in general? Like you had to go through that process. You opened up a retail shop. I mean, you guys needed to build up a clientele. So looking back, what's some advice that you would give to somebody?
Yeah. Don't open before a pandemic. So do some psychic stuff to see if there's a pandemic around the corner. Yeah. And once that's done. So for us, I think things that we did really well was opening slowly, build that clientele because, no matter what all these, I roll my eyes, but it's like banks and books tell you like, this is how much you need in the bank. And this is how much you make before profit and all this kind of stuff. You can't make someone walk through your door and spend money. And for us in aesthetics, you could come in and get a $500 treatment or a $5,000 treatment. We don't know what that treatment is until you tell me what's wrong or what you're hoping to do to your face. So clientele is huge. And
that's really marketing.
Right.
That's getting the lead.
Yeah. Cause you need a significant amount of following before you can pay for, your rent and your bills and your lease improvements and all this kind of stuff.
Right.
And then I think holding on to those clients, because one of the biggest things we have at Form, and I always say, is like our clients are loyal to the end. And what's amazing is it just makes everything so much easier, but you need to treat them with respect. You got to, kind of my shtick, and I'm not a big business expert by any means, but it's like, to me, it's all in the details. Like during the pandemic, we've had to cut back some of the luxury things that happen at Form. And one of them is we have a really ridiculously expensive coffee maker. And I really had to push, to get it during the early business stages of buying a $30,000 coffee maker. Keurig, no joking. And it's an espresso. Anyway, and it was one of these cells, but I'm like, the little details change people's things. And during the pandemic, when we had to stop coffee service, the amount of things we have from patients being like, oh, I miss the coffees. And I'm like, I'm glad my work was, life-changing for you.
Yeah, I put stuff in your body.
Yeah,
right?
like I performed a treatment on you, and they're just like, I know, but the espresso, like the cappuccinos here were so good. And I'm like, I know they were. And someday when the world gets back, we'll have it again. Yeah. So it's, or like, the hand towels, or having to go to paper towel, and they're like, oh, I miss the hand towels, or I miss the scent, or these little things. Yeah. So like those little details really accumulate to a major business marketing thing. And I think people sometimes take that for granted, because sometimes we've all been there, you go into a store and it's like, oh, they do one little thing. You're like, oh, amazing. And then the one time you go and they don't do it, it's like the end of the world. It's like, where's my little finger bowl or my cold towel before I sit down? Like, you expect me to eat sushi and not like cool the back of my neck down?
I get it.
Yeah. And I think
we picked up groceries from, Alicia went and when they brought the groceries to our car, they gave her a granola bar.
Right.
And the next time they didn't.
Yeah.
Oh my goodness.
Yeah, it's why do I shop here? This is ridiculous. Yeah. But it's those little things. And I think consistency, and once again, at any business marketing, people tell you consistency is super important. Yep. All that kind of stuff. But I think it's those, consistent little details, like coming in and just like the way the towels are folded, or how there's a robe available if you want to switch in it for whatever reason, or how the place looks. I'm a huge person on scent. So like at Form, we had our own scent made, like a custom scent thing. Okay. But it's hilarious because, There was a brief period of time when the hand soap was on back order or something, and people were like, where's the good soap? It doesn't smell right. And I'm like, you're right. So those, and I think taking an extra month, 2 months, 6 months before opening a business and like looking at those details. And I think that's what Dr. Patterson and I do well, because we look at things definitely differently when it comes to that. And mine is always, I've been fortunate to travel a lot. And when you look at anything from a hotel to a restaurant or those things that stick out, it is details. Like, yeah, the food was amazing. What did I eat? Oh, maybe I remember if it was really out of the world. But what I do remember is like, when the drinks came, there was this like smoke and fire thing, and blah blah blah, and there was this
and it made you feel something.
Yeah, exactly. Or I went to the bathroom and it's like blah blah blah. And I remember I stayed at a hotel once, and I remember like, I don't know why. Don't judge this next thing, but for some reason I looked under the bed. And there was a little card and a red carnation that says, yep, we clean under here too. And it was a fresh flower.
So good.
And I'm like, damn. And then I really started like going through drawers. And I'm like, this place is really clean. And I'm like, wow, this place really is. And I would like tear a petal and it was changed every day. And I'm like, wow, they have a flower under the bed. Like that's classy to the max. So, and if anyone goes to Ireland, I will tell you, let's stay at Ashford Castle, but like, it is an amazing place to stay. So I think those little details, certain stores, they're putting your receipt in a fancy little envelope when they hand it to you. Those details are huge. So I think knowing what your business is and having a marketing plan that includes a detail that is you, that is only you guys, whether it's how you hand the receipt, whether how you send out text or that one thing, because repetitively people expect it, and you also commit to it, right? And so always stay there and keep that level of commitment. And Form, we spent a lot of time working with the design shop, who are amazing, and Debbie Golub, who played a huge role in the design. She was the design, but she has a background in psychology. So everything about her is like how space acts and like how you live in the space and the psychology of like, well, if you're opening that door, you're going to be bent over and your patient's going to see your butt. So the door has to open the other way. And I'm like, oh my God, that's what people think about. Like, I'm like, oh my God, how many times have people done that in my other office?
Sight lines and function. And,
right. And so from when she designed the furniture to where she chose where the power outlets were so people could charge their phones, she 100% did it. So if you were uncomfortable, didn't want people to see you, there was a place you could hide. Or if you came with a friend, there was a place you too could hide, and all these pods and like all these details and how the couches were shaped. And I'm like, holy, that's a huge thing. But that's why she's amazing at what she does. And she designs amazing clinics and dental
And they
offices.
got their Instagram back.
They just got it back. Yeah. Which is horrible that, once again, 2022 things we deal with.
Crazy.
Yeah. But those things are so important. And like, I think when they all come together, it makes an amazing business. But I'll be the first to say, like, Debbie did an amazing job designing my business. Trickett and those guys did an amazing side building the design that she did. And now we live in it and all that kind of stuff. So yeah, it's so layered in everything. And like knowing, and once again, it comes back to details. And Debbie's like, she was with us being like, well, show me your marketing. What are your colors? What's your website look like? Because, okay, if that's what you want your website to look like, I want to have a room that looks like this and blank and blank. And people who do social media, when you leave the room, what's the first thing they're going to do? They're going to do a selfie. So we have to make sure the light's good for selfies, because when you're not looking, they're doing selfies in your room. And I'm like, oh, that is valid, because that's the first place.
That's where I would do one.
Yeah, exactly. Like, I'm just going to go wash my hands. I'll be back. That's when you do like your own before picture. So when they leave afterwards, you do another one. You're like, oh yeah, that does work on my camera. Yeah. So things like that are kind of interesting, how they all play and work together. And I think I didn't know that before going into a business, that was so important, right? And I think luck and Dr. Patterson being a little bit more into the business side of things, how it work, and coming from a business family played into that. But me being like, everyone, like, this is awesome, make it look pretty. Well, pretty has a different aspect in how things look and act and work, and how doors open, and where people sit, and why they want to sit in certain places, and why they might choose to sit in that chair or that chair. And I'm like, ooh. But yeah, so when you're starting a business, I think it's get the right team of people. Because once again, I was all about, where's the fancy coffee maker going? What's the scent going to be? And all this kind of stuff. That was me, but mixed with functionality and the psychology. It all came together to have hopefully the perfect clinic.
Yeah.
Yeah.
So you mentioned traveling, and you and your husband, Rob, have traveled a lot, right? And you've got to experience many different cities, cultures, experiences. So what is it about Winnipeg? Because Rob's from the West Coast, you're from the East Coast, you're
I've
in
lived
Winnipeg.
everywhere.
You guys legitimately, doctors can get reciprocity or they can challenge exams.
Yeah.
Medical aesthetics can be done
Anywhere.
anywhere. Everyone wants them. What is it about Winnipeg that keeps you guys here?
Okay, I get asked that question a lot, especially living in Miami and Bermuda and some really nice countries. Rob living in Australia and Ireland. It's like, why'd you pick Winnipeg? So it didn't start off this way, but it was a mixture of what Winnipeg is. And what I mean by that is, I can teach at the university. I have a faculty role there. I have my own practice. I can have a medical aesthetics clinic. We're big and small. I know a team of specialists that I know by first name. I can shoot a text as a GP to friends in radiology or OB gynecology and ask them questions. There's the collegiality. The universities here, we have a lot of, we have MRIs, we have PET scans, we have all that. It's not a small community, but yet I can be anywhere in 20 minutes. There's professional sports teams. There's a great living style. The cost of living's low. Like when I graduated, I got headhunted for a job in Banff and Canmore, one from Vancouver. And when we went and looked at it, it's like, when you factor in cost of living, could I have a faculty teaching role because I really enjoy teaching? Well, there's no universities there. So, do I want to give that up? What's the aesthetics world look like? Well, okay, it's a very small town. So there's, 3 aesthetics clinics. Can it handle a 4th? That kind of stuff. But Winnipeg is a big little city where it's like everyone can play nicely. It was one of those things where it happened. It just snuck up on us where it was like, okay, we'll do 2 years and see what it's like. And then 2 years being like, okay, let's stay for another couple of years. Let's look at other jobs. Where do we see ourselves? And then it's like, okay, let's get a house. This is a great place to potentially raise family. There's good schools. It's safe. We don't have that. The airport's right there. Like it's a 20-minute cab ride or $20 cab ride. We can be at the airport and to another place really easily. Where, I won't say her name, but somebody I graduated with in residency, moved to Vancouver and got a job and stuff. And when she went to get her 850 square foot condo, she had to get her dad to co-sign because as a physician, she didn't have enough financial backing to.
Right, yeah.
And I was like, oh God, I definitely don't want to live in Vancouver. And then, living in Toronto where you don't know the specialist you're sending someone to and you're just getting these reports back and you have no idea who they are. You talk to them on the phone, you have no idea. Here we know everyone, right? And that's for me, being a bit of a people person as well as needing that sense of community. Like we have no family here. We have our medical community because we trained here. So the people we were training with, we become very close with because we're literally, for 2 years, I've lived with the same residency people going through family medicine residency. And basically they're my family. And through them, I've met other people and stuff. But at the same time, those that are Winnipeggers are friendly. Like I'm Jewish and like I have family here that that I've met through here that like, if I can't go to dinner, they'll change dinner. And I'm like, I'm not part of your family. Like, please go ahead and have Rosh Hashanah. And they'll be like, no, you can't come. You work that night. We'll change it. And I'm like, well, you can't change the holiday, but they'll do it for me because I've been to every Rosh Hashanah since I moved here. And they found out the poor little Jew boy didn't have a family to eat dinner with. So they invited me. So those senses of community, which were huge for Rob and I, added to making a decision, which was pretty easy to, it was easy to open a practice here. We could open the practices we wanted, but we had those extra details, much like in business where it's like the sprinkles on the cupcake or whatever, but like I could have a small teaching role in the faculty, which I really enjoy. I can deliver my babies at the same time, open aesthetics practice at the same time, have a GP practice at the same time, teach internationally. I can do all those things. And I don't think you can do that in a lot of big cities or how some provinces have their models like New Brunswick, where my dad's from, their model is very different. They cap doctors. You can only make a certain amount of money per month, no matter how little or much you work. There's only a certain amount of actual billing numbers, which is what we need in order to bill the government for medical. So they cap, and there's, when we graduated, there was no job for Rob. They would hire one of us, but not 2 of us, even though there's a doctor shortage there. Right. And it's like, that's great. And because on paper, I'm bilingual, I would say I don't have the credentials anymore. Like they're like, okay, we're going to put you in a Francophone thing. I'm like, ooh, let's not do that. Let's not put me in a French hospital because I don't know if my skills are that good. So, this province is very much like, what kind of practice do you want? Let's work with you to make that. And that's unique to Manitoba, which was a nice little thing. Winters are a little bit hard, but they're sunny and bright. Vancouver's rainy and cold. So anyway, after much discussion, it was an easy way to stay. And it was kind of, I think if you had asked myself from Rob, 9 years ago for me and 7 years ago for him, will you live in Manitoba? It's like, oh no, it's a stepping stone.
Yep.
I'm moving to a little place called Dauphin where I'll do a lot of snowmobiling, and I need a truck.
Yep.
And then after that, we'll see where life takes me. Fate or whatever things lined up, got married. We'll buy a house. No, we have a 35-year mortgage. I guess we're living here for 35 years. Oh, I opened a business. I'm definitely staying here it all lined up. And you meet your own friends, which easily become family, and that all just kind of slides in. But Manitoba was easy. And like looking at jobs when we were kind of actively looking for other jobs, it wasn't easy. And I think being trained here, of course, helped. But at the same time, just knowing you could open a business, pretty easy. You can make a go out of it. You could make your career what you wanted to be in healthcare here. And that was important to us because we both didn't want the stereotypical Monday to Friday, come in, blood pressure, diabetes, thanks for coming. That wasn't us. And we could easily make the practice we wanted. And I think that was huge. And, having the university and having good colleagues made that super easy for us. So.
Quick follow-up question.
Yeah.
What would you change about Winnipeg if you could?
Weather? No.
That's fair.
It doesn't bother me that much. It bothers me like maybe 5 days a year.
There's certain
There's just certain days, like when your car doesn't start and it throws your day off, or you forgot to plug it in. Like, first world problems, definitely with the current world we live in.
Your door freezes shut.
Yeah,
your
like
key
those
won't
things.
go in.
Yeah, there's not much because the one thing I'll say about Winnipeg that surprised me is how everyone embraces winter here. They don't hide for the winter months. Like they're at the Forks. Like when it's nice out and you go to the Forks, pre-COVID, and it's just like thousands of people, and I'm like, holy crap, why would anybody want to be out here? But then you're going like, this is really fun, I had a great time. Where on the East Coast we kind of hunker down after New Year's and we're like, we'll see you in the spring,
see you in May.
Yeah, exactly. That's kind of how we do it. And even in like Florida and Arizona and all these other places I've lived, there's just certain things you do, right? Like, oh, you go hiking on Sunday, that's your go thing, or beach every Sunday, or things like that. So here it's so varied, and like I'm still learning. Like I don't get this whole lake country or lake cottage world that people rush out of the city every Friday and rush back every Monday. But I don't know. Weather would be one, and then the other thing would be, I don't know. Yeah, I find very comfortable here. I love the traffic. Okay, yeah. Oh, I know. Parking.
I knew there was something.
Yeah, how you're like driving and all of a sudden it's like you can park on a major like on Academy. All of a sudden you can just park there and then you get stuck there for 10 minutes trying to go around. Yeah, I haven't lived many places where you can just park on a major street.
Just wherever you want, just throw on your blinkers.
Yeah, that's my big one. Yeah, that's my road rage moment for sure. Because I'm also a bit of a nervous driver, so I'll like politely wait there, and it's like, it's been 10 minutes. Somebody let me out.
You know what? I next week, I think it's next week, I've got Counselor Kevin Klein on.
Okay, there we go. Bring that up. Would you fix that
I'll make
for
sure
me?
to write that down.
Thank you. Yeah. Make a note.
We'll bring it up. Going a little deeper here. Did you always know that or believe that you would be successful in life? Like, was that always something that was that ever something that you thought about, or was it just kind of
because I don't have a ton of self-confidence and I'm extremely self-deprecating. I do hear it a lot from people because I've had an amazing life, and I do appreciate that I have. Definitely very lucky. I've lived all over the world. I've had amazing jobs. Things never played out the way it was supposed to for me, and I don't come from a lot of means or whatever, but looking back, everything happened for a reason. So like my big thing, I want to be a doctor. So I did my undergraduate and did really well, and scholarships and all that hoopla, but never got in. Became a lab scientist. Literally one night at midnight, the three juniorest people in the middle of the night running the hospital lab, we were having lunch together, and we were just like, is this our life? Like we're 23 and we work midnight to 8, like keeping the hospital lab going. And one of them was like, hey, there's a job here listed in Bermuda for 3 people. We should apply. We applied. A week later, we moved to Bermuda. That job led me to have amazing friends and connections, but it led me to have other amazing jobs and meet amazing people that opened doors. I got involved in third world humanitarian work in Haiti. That led me to meet an amazing physician in Calgary who was like, come with me to Calgary and I'll show you what a family doctor does. And I went and worked with her practice and fell in love with it. And that connection led me to get into med school, which led me into the States, where I worked with amazing people who opened other doors for me and got me amazing internships and things like that. So I've had an extremely fortunate go. I wouldn't say I sat there and be like, oh yeah, I'm going to be like completely super successful in life. I definitely had the drive because I didn't matter. Like if you ask my dad, I always shot for the stars because it's like coming from a small rural town in New Brunswick and having, just regular Joe folks that worked really hard and provided for their families. They'd be like, why do you want those things? Or, those are expensive shoes. You get these shoes. I'm like, I'm going to get these shoes. And I was that kid who had a paper route and like worked in a restaurant and had all that because my dad wouldn't buy me the shoes I wanted. So I was going to buy them myself.
Yep.
And that, ethics and stuff, I'm sure played a huge role in it. But it was like, I didn't want to be that whole, I'm going to live in my hometown. I got my degree. I'm going to come back and work. I always wanted more. And, I've reflected a lot, especially during the pandemic, and that move to Bermuda, because I was a homebody. Like I remember I moved November 4th. All my family had bets I'd be moving home by Christmas. And I made it through. And, 7 years later, and amazing connections and friends and working all over the world and working for, amazing companies and countries and stuff like that just opened so many doors for me. But it was one of those things where it's like, I didn't want the just like stereotypical whatever. And I just went for it. And, I'm always one of those two, like I'm always up for an adventure, whatever, like jobs. Like I worked at the Betty Ford Center. Well, that was literally out for drinks with someone who's like, oh, I just did this internship there. It was really fun. You should apply. The deadline's tomorrow. So like went home after having several drinks and decided to apply for an internship at the Betty Ford Center and got it. Yeah. And I was just like, oh, I guess I got it. I should go. And then that led to other jobs and other opportunities and things like that. So it's amazing. And it's like, and my husband's the same. He's one of these guys that, looking at would be like, oh my God, everything comes easy for you. Because in med school, he became Mr. Gay Europe and he's on a stamp and he's like literally seen all the world and things like that. And when we travel, he's like, oh, we're in Bangladesh. Let me call my friend, Mr. Gay Bangladesh. And like all of a sudden then we get to go to bars and it's openings and all these kind of like, what the heck is going on? So I think on the outside looking in, people are like, oh, you guys, whatever. But at the same, we all have stories, right? He couldn't get into med school. So he went to Australia and did his master's, who met people. And then he went to Ireland and did it. And everything just kind of meeting people and both having that same kind of, you meet people for a reason, right? And you treat them like friends. And I think when we got married back in 2017, like we had 350 guests, but like we had like 36 countries. And it was because it's like, well, this table's when Rob lived in Australia and these are my friends from Bermuda and these are my friends from when I did Broadway and these are my friends here. And it was like, people came to our wedding and they're like, there's a lot of different people here. And I'm like, yep, this is our lives. This is how we live every day. And it was just amazing. And I think things happen for a reason. I'm not religious in any way, but there's something bigger than me out there. I don't know what it is. But it all, negative things. Like if you had asked me, oh my God, I'm showing my age, 15, 20 years ago, what's your biggest disappointment? It's like not getting into med school, not getting into that specific med school because that's what everyone else did. And they get in the day they graduate undergraduate, they go to med school and blah, blah, blah. That didn't happen for me, but I didn't want to sit there and take it. So I was like, okay, I'll do my master's. I'll do this. One thing leads to another. And I think just being willing to keep going forward and then things will eventually. And, looking back, I'm glad it didn't happen the way it happens for everyone else. I'm glad I went to med school older. Like I remember I wasn't super old. It was my late 20s. And when I went to med school, like I went to bed at 9 every night. And my roommates who were all like 22 were like pulling all-nighters. And I'm like, nope, I study every day from 6 to 9. If I don't have it in there by then, I'm too old for this.
Yep.
Meanwhile, they're just like, cramming the week before. And I'm like, oh no, I can't do that anymore. I'm too old for that. And having lived a little bit and stuff like that and had some life experiences of living on my own and then seeing young people, like I have friends that graduated residency and they're like 22. And I'm like, oh my God, when I was 22, I don't even know if I did my laundry like appropriately. So yeah, I think you just got to take everything, but learn from everything, whether it's negative or the worst day of your life. Of the day I got rejected for the 5th time from med school. Yeah, let's see what the 6th looks like or feels like. And that's how I took it. So
that's phenomenal.
Yeah.
Earlier you mentioned consistency as being really important in business. What about in your life? Is there something as far as daily routine or something that you have to do every day that you make sure you get in?
I'll answer this pre-COVID.
Okay.
Because COVID has messed my life up.
Very fair.
In a lot of ways.
This whole thing should have been COVID aside.
Yeah, for me.
Every answer.
Because I've taken on a lot and my husband has like, stepped up and worked for public health. So we don't have our normal routines. When I'm in my routine, I'm phenomenal. Like I lost 272 pounds and I used to be overweight. And like, I love routine. Like I love getting up at 5, going to the gym, doing my thing. Like that is what my body thrives on, to the point where close friends were like, I almost hate vacations because it throws me off. And like, I'm like, oh my God, I slept until 9:30. I can't do anything until noon because my brain's not working.
Yep.
Meanwhile, I have no problem getting up at 5 and going to the gym and doing my thing and having my coffee and being to work and doing my paperwork when it's still quiet. I'm a morning person. So I do thrive on consistency. I am 100% a better person when I'm consistent. And a little bit of that is also when you throw that off is when, once again, a vacation can throw me off because I'm like, my body's just like, oh my God, I need a nap. Meanwhile, the week before I had like, rounded at 3 hospitals and did all this stuff all before 9 o'clock and I'm not tired and I went to bed. But it's like on vacation, it's like, oh, I had breakfast. I better go lay down because it's 9:30 already. So I do thrive on consistency in a lot of things, as well as I think when you're consistent, you can roll with the punches easier. Like in my world where, I can be called to a delivery at any time, even though I have a completely booked office practice. Knowing how to manage my day and manage me and having the right staff is always great. And I know my staff have my back and I know my limits and things like that. And then through age, knowing your limits too. Like, even though I do work 7 days a week and I work 24 hours a day, I take one Sunday off a month, that's day, to get caught up on the mail that I haven't opened or things I haven't billed or the emails that have lined up. So with time, I've learned, sometimes you just got to roll with the punches, but at the same time, consistency for me is huge. There's other people that can handle more, but I just love A, B, C, D, E, F, G, straightforward. Yeah.
Yep. Well, it is a Sunday today and it is your day off. So I don't want to monopolize all of your time, but I appreciate it. Now, is there anything that when you knew you were coming on here, is there anything that I didn't ask you that I should have?
No, because I really didn't know what to expect. No, not really. No, it's I think business and knowing you and being that like positive person and how you're always trying to like push, it's exactly what I expected. And I think I definitely don't look at myself as a huge leader in business because I think there's always room for improvement. And it comes back to that not having ton of that huge ego or self-confidence. I'm very glad of what I've produced with Forum and the things I've stuck to and what I think is extremely important. Because I think, with the pandemic and things, it's being like, okay, don't reject any patient. Like we need money flow. And it's like, nope, I'm not going to, that person has enough filler. I'm not going to put more in there because I don't think it's appropriate. I stick to my guns and, I am proud about those things. And I think businesses, and it's funny because I know you probably haven't had medical aesthetics people on here, but they all come down to the same thing, right? And like we have friends, you own businesses and we have mutual friends that own businesses. And when you talk, it all comes down to the same things, right? Like people are successful for certain reasons, but at the same time, there's fundamental core principles for everyone. And you read enough books and they're all in there. But when I'm stressed out or whatever, and I think of these other people or other businesses, I'm like, we all have the same problems. None of us predicted the pandemic. You know what I mean? And you can only control so much. So you take that with a grain of salt, but at the same time, I think if you just go back to your core principles and you have your amazing clients and you stick to all the little details and you keep them happy, they're waiting there. So when we were closed during the pandemic, trust me, we had people being like, I need my Botox. Like, when are you opened? And I'm like, oh, we can't be opened right now. Well, the first day we turned our sign on, how many people can we possibly do in a day? It literally turned into, and that just makes you love your clients more and makes you like, okay, we're doing something good here. Like people literally waited and, they're just like, my husband hasn't seen me like this in 25 years. And I'm like, oh, well, let's turn back the hands of time. So those things are great. So no, I think, this is exactly what I expected, as well as a little bit more. It wasn't, I'm definitely, I don't know any big secrets, I don't think. But
what were the biggest influences you would say on you in your life, whether that be books, people, mentors?
Oh, definitely people.
Yeah.
So I hate reading. Medicine ruined that for me.
Med school would have been different
because I try to memorize everything, so I don't enjoy books because I'll like spend 45 minutes going back to chapter 1 to try to figure out a date or something they mentioned casually. So reading's not enjoyable because I'm memorizing. 100% people. So I will always say, whether it is my acting or my theater background or medicine or any job that I had that's super important is all because I've treated everyone the same, and friends for lives kind of thing. Like when I got married with my husband and just looking at I'm like, oh, I have to invite this person. He's like, who is it? I'm like, oh, that's my friend from grade 5. He's like, you still keep in touch with that person? I'm like, yes. Or this person was
of course I do.
Yeah, you don't. Or this person hired me for my very first job when I was 13. You still keep in contact? Absolutely, I do. What are you talking about? You don't keep in contact with that person?
Right.
That's also, my personality is very different than my husband, where he's just like, oh, this is my friend from last week. They're coming. But we could easily had 10,000 people at our wedding. But people and experiences, even people that were potentially negative at the time, not burning that bridge has turned into, there's been times in my medical training where it's like I finished an elective and I didn't have one lined up. And I just happened to say that. And someone's like, oh, what are you looking for? I'm like, oh, I need a psychiatric rotation. And I really want to do it in pediatrics, but it fell through. So it looks like I have to wait 2 months to get another one. And they're like, oh, I know the dean at whatever. And be here Monday. And it's all because I just treated people like friends. And whether it's, my East Coast upbringing or just my personality, I think it doesn't matter who you are, you treat people with love and respect. And you're open-minded with love and respect, it's never going to turn you wrong. Yeah. And those situations, 100%, whether it's mentors or in passing being like, oh, I'm really struggling with this one thing. Oh, I'm not good at it, but I know someone it is. And then you meet another friend, and then that other friend's helpful. And maybe they rely on you for something. And I have no problem helping people oh, do you know anybody that can do this? Absolutely. Boom, boom, boom. So hands down, I wouldn't say any formal mentorship, but just people in general, and just treating people with lots of love and respect, because sometimes you need them. And I don't like asking for help, but at the same time, people are like, no, this is what I want to do. I want to help you. And I'm just always shocked when people step up for that, because I would do it in a heartbeat. But at the same time, it's people from 15 years ago, knowing you can rely on them to this day is just a ridiculous thing. And it makes me, there is good in the world.
Yeah.
I'm really unhealthily obsessed with Mr. Rogers and his child psychology, because I think he did a lot of good things.
Yep.
And with the world we currently live in, his quote about during bad times, always look for the helpers. Mm-hmm. But that's in everything in life. There's always that one person that is going above and beyond in a negative situation or a positive situation. There's that one person that sticks out. And I think I've always believed in that. And especially during our current times, that's even more important. But in your life, there's always that situation, but there's always something in that situation that you can take from, negative or positive, that's going to benefit you in the future. Mm-hmm. And I think accepting that, embracing it, is always going to be helpful. But
well, that's phenomenal. There's no, it's no surprise why I really love Daniel Tiger, which is the cartoon based off of Mr. Rogers, because it teaches kids everything that he's been pushing.
His way of child psychology and child development was years above. And I don't know if people know this, but like I said, I'm obsessed with them. But when the World Trade Towers happened, the government actually paid Mr. Rogers to come out of retirement to do a show to explain to kids, because he was the first child show to say grandma and grandpa died, and that it's okay to feel sad and how to accept emotions. Kids can handle, and this is why I love kids in my practice, because kids can handle tons of things. It's just how you present it to them. Right. And Mr. Rogers had things about when your cat dies or when grandma's sick. And that was huge back when Mr. Rogers was new. But to this day, they've done studies where they showed clips of old Mr. Rogers, and kids want to watch them over the newer cartoons and things like that. And he just had such amazing fundamental principles based in child psychology that, he worked for Stanford, and they still reproduce those all the time. It all comes back from what he did on his show. He had the first physically disabled person or child on the show, and that was huge. And he's like, what's the difference between that? So they had to make the whole soundstage wheelchair accessible so he could have that. He, it was just, he just did some really great things that everyone could probably still learn about. Adults to this day could probably take a lesson from some of those super basic principles that he taught kids about sharing and caring and emotions. And it's okay to be mad. It's okay to be sad. Yeah. And you see therapists today, and I'm like, yeah, you just need to go watch Mr. Rogers. You don't need any big therapy. Yeah.
Oh, that's phenomenal. Well, I really appreciate you being here. I appreciate
thanks for having me.
Who you are as a person. I think that you know more than you give yourself credit for. I think that your success in not only your medical career, but in form as well, has a lot to do with who you are as a person, how you treat people, and how you maintain those relationships. And I think that if there's anything that I take out of there, other than the details and the importance of details, you know, how you treat people and how the people are the pretty much number one thing that guarantees success is I think something that everyone in every business can learn from and help them do their stuff. So I love this because it's not only anyone that was in your position, but also anyone that's opening any business can learn so much from this. So that's the beautiful thing about podcasts and learning your story, because there's going to be someone out there that relates to this, and that says, "Hey, I was there too," or this did Dr. Leon said
write
this.
that down.
Yeah, right. So I really appreciate it. Thanks for taking the time.
Cool. Anytime.
And, you're welcome back anytime.
All right. Thanks, man.
Thanks. Bye-bye.
Cool.